All right, Doc, so let's do some practice questions real quick. If you're afraid of med-surg, maternity, or pharmacology, let's see how these questions are worded and let's get through them. All right, so now let's look at this one. It says that a client with bipolar disorder is admitted to the psychiatric unit with acute mania and dehydration. What prescription should the nurse question? Now, it says that they have acute mania and dehydration. I'm going to zone in on that dehydration. So for me, the one that would need follow-up is going to be the continue prescribed lithium. Remember, the patient is dehydrated. That means that they have a sodium problem as well. That means that their sodium levels are low. If you remember anything about lithium, you have to always have proper sodium levels to even give lithium, right? This person can have lithium toxicity if sodium levels are imbalanced, if sodium levels are low. I'm going to choose 3 for this one. And that's exactly what it is. Given Haldol and lorazepam is fine, I think that's the B52. It says that the nurse is talking with a client who is being discharged after an open radical prostatectomy. Which of the following statements by the client would require follow-up? This one is actually the correct answer. If I get constipated, I will use a suppository. The prostate gland, how they palpate it is through the rectum. So if you did a surgery on an organ that can normally be palpated through the rectum, why are you going to use a suppository, right? Why are you going to introduce something new to that areas? The nurse receives telephone messages from the following 4 clients. What client should the nurse call back first? So now we're going to talk about priority. Doxycycline is a tetracycline. This is an antibiotic. Most antibiotics cause sunburn, so that's fine. I wouldn't call that person back first. Now, if I had to choose between the two, I would think I would choose the phenytoin one because of the flu-like symptoms and the new painful skin rash. This would be the gingival hyperplasia. So personally, I would choose the phenytoin because of the flu-like symptoms and the painful skin rash. There we go. Next now it says that the nurse is caring for a client who has acute pericarditis. Which of the following will be priority to follow up? If you have acute pericarditis, that means that you have inflammation of the pericardial sac. Now, chest pain that worsens with deep inspiration, that's normal. Muffled heart tones and jugular venous distension. I don't even have to go further. This is the answer right here, right? Because this just tells me tamponade. And remember, cardiac tamponade is an emergency. This person's heart is being squeezed by blood in the pericardial sac. This person is going to die if you don't do something. Nurse is teaching a 36-year-old client who has a new prescription for a combined oral contraceptive. Which of the following statements by the client would require follow-up? Now, the statement here that stands out to me is 2. I am currently considering several different smoking cessation options. Reason being, it simply means that she's still smoking. And remember that you cannot smoke while you're taking these combined oral contraceptives. You're going to be at risk of blood clots and you're going to be at risk of hypertension. And boom, there we go. Remember, look at the wording. I am currently considering. That means that she's still smoking. Always remember that practice makes perfect.